here now, 7:50 is the time. It's a difficult disease. It does not discriminate by age. Congenital Heart Defect Awareness Week is happening now. Darren McBee and Christopher Olenewski. Did I get it right?
Good
Almost.
Enough. Yeah, right there.
I always try it right before, and then a lot of times it goes right before we begin. But they're here from Mended Little Hearts of Greater Baltimore. So first of all, you're here with some adorable kids. We're going to tell their stories in just a moment here. But how, in the first place, do you find out about congenital heart defects in most cases?
Well, in most cases, you find out from the 20-week ultrasounds.
20-week ultrasound, that's right, absolutely. In addition to any list of things that you can look at once bringing the child home from the hospital, but we would highly recommend that before you leave the hospital to have a pulse ox examination.
A pulse ox examination, okay. A lot of folks, I think, may not know about that. So it's, important to talk about these things here this morning and give folks some of the tools and resources they need to help prepare them and prepare them for what comes ahead. Let's get to some of the really cute kids that we have here. We want to tell their stories. Of course, that's our hook this morning. So where should we start, Dara?
Well, we have Jaden. He is 5 years old. He has a hole between the two ventricles, or I should say had, because he did have a surgical repair when he was 2 months old. He actually had congestive heart failure and an enlarged aorta as well, so a lot going on for him. Miss Sydney just had her first birthday. She also has a hole between her ventricles and a leaky valve. She hasn't had surgery yet, but she will when she's a little bit older, maybe between 2 and 4 years old. So she has that coming up. Miss Emery here is holding a picture of her younger sister, Anya. Anya actually had a condition called hypoplastic left heart syndrome, where the left ventricle did not develop. And she had surgery when she was only 2 days old, but she lost her battle when she was only 2 months old.
This can be really a difficult thing for parents. It's scary. Talk about that a little bit. Have folks who maybe have gotten a diagnosis and don't know what to expect. And obviously each diagnosis is different.
Well, truly, that's what Mended Little Hearts of Greater Baltimore is all about. We're a nonprofit organization that provides support for families who have never experienced anything like this, a congenital heart defect, and it can be very difficult and trying. One of the things that I really get out of the organization are the monthly support meetings that we have and the educational speakers that show up. In addition to building awareness, we utilize fundraisers, we participate in awareness events such as heart walks, and even provide these necessary and essential supplies for families who are blindsided by a congenital heart defect and don't realize that they have to be making an extended stay at hospitals like Johns Hopkins and the University of Maryland Medical Center. So it's a
great event. Some great stuff happening this week, which we run out of time for, unfortunately, but we do want to make sure we'll put it all on our website at foxbaltimore.com. A very important week and a very important thing to talk about. Mending Little Hearts this morning. Thank you both so much for being here, and thanks to all of you.
Thank you for having us.
Coming up here for